Good afternoon, members of the jury. You've been gathered here today to make a very serious determination. Did AU Hospital impermissibly disclose protected information of one of its clients, Jennifer? As you know, these are very serious charges. Keep in mind your decision must be made without a shadow of a doubt. Jennifer's attorney states that the hospital failed to make a reasonable effort in contacting the patient when the subpoena arrived. I disagree. As we all know, for those of you who are not familiar with HIPAA rules, when you go to the hospital, you have to sign that we will always maintain your patient rights and the privacy of you, your individual privacy. The Health Insurance Portability and Accountability Act, the HIPAA, states no agency shall disclose records which maintains records of communication to any person or any other agency without the written request or prior written consent of the individual whose records we are attaining, unless the records would be the law enforcement purposes, congressional investigations, and the Department of Homeland Security. Therefore, the AU facility was subpoenaed to release medical records for Miss Jennifer. They made several attempts, and it was documented in the patient's electronic medical records that they tried calling 4 different times, sent a letter to the home address that was listed in her patient demographic online, and there was no answer. So AU finally released the information, but not until they removed all patient unique identifiers, social security numbers, phone numbers, patient address, patient's emails, patient's date of birth. They whited out all of that. So even though the attorney had subpoenaed the papers and they documented and verified that that was the patient's medical records, they then blocked out all the information. Unfortunately, the plaintiff never updated the demographics, and she had moved 6 different times in the past year and changed her phone number 4 different occasions this year. So therefore, you can understand it was very difficult for the AU facility to reach the plaintiff. In fact, the documents stated that she was running away from fraud and evasion. So they tried and made every effort that they could before the medical records needed to be released. The facility has now taken steps to correct and improve on its process. They have increased their privacy and security training for the staff members, and they update all the demographics each time the patient is seen and or admitted. Therefore, there's always going to be relatively new updated information when trying to reach the patient. So ongoing training and updating the demographics really helped us getting a hold of patients when we are subpoenaed. Therefore, jury members, although the AU staff was unsuccessful in reaching the plaintiff to sign the release of information when abiding by the subpoena, they took every step to de-identify to ensure the patient's privacy rights were not violated and the patient information was not jeopardized. AU Hospital has immediately taken steps in better securing the privacy of their patients. Therefore, they are not guilty in disclosing patient privacy information, and however, this decision is now up to you. Did the agency violate the patient's information? Did they make every effort in trying to reach the patient? Unfortunately, the patient did not want to be reached. So, please take in consideration before you make this determination, because the AU University is not guilty.